Next, I can combine the side bend towards the table with rotation towards the right in that position, which exactly counters his rotoscoliosis. Now then, I can start to get very fancy because I can now put my fingers underneath the paravertebral muscles on the right-hand side of these spinous processes, and I can do a whole series of just little soft stretching mobilization. So as well as doing the muscle-based techniques here, you can see at the same time I'm doing the stretching maneuvers like this. So just stretch, relax, stretch, relax, stretch, relax, stretch, relax. Now, can you just hold me from just brace against me just gently? He does exactly the right thing. Now relax. Now make your right leg longer. There, and he'll go down into the correct movement. Okay, push your right leg down, make it longer again. And I can actually bring about a agonistic correction of these muscles. Just push down here, and he's doing the correct side bend now. And again, and down. Great. Now let's go back to this. And so I can do a series of side flexions, or I can concentrate on the side flexions, or I can do this, and at the same time I can do this. Like this. And so I can do a whole series of sort of stretches here, looking for sort of individual areas where we may get tight bands. Perhaps pulling a little bit more across there if we want to sort of stretch a little bit more onto the quadratus lumborum. So there. So I think that this is an example where we can use soft tissue techniques, we can use muscle-based techniques as well as massage techniques, along with articulatory techniques as well. And it's a very, very satisfactory sort of thing to do. It feels good. I've got a student with me at the moment that does all this for me, you know, and he'll do it for ages. I go in and he's still working away like this. He's a really good guy. And I know when he's gone, it'll be, oh, I think that's all right today. Because this does take time, but it's still very well worthwhile. You know, and it's an interesting thing into my town. We've got all these massage clinics and people are willing to go and pay $40 and $50 for a massage. They wouldn't pay that for a physical therapy treatment. And they want all sorts done and joints moved and things done, but they'll go and let somebody stroke them. Okay? And I don't think, obviously, you know, they're doing much less in terms of what we would consider to be really important massage techniques, which are these kind of translatoric things with good stretching and so on, with this muscle relaxation. So it's surprising what people will pay for, you know. And there seems to be clinics opening all the time for massage only. And orthopedic evaluation I see now we're getting on the windows. Biomechanical orthopedic assessments that all the masseurs are doing. Very interesting, isn't it? I say that and the orthopedic surgeon has a fit. Well, one of them does, but yeah. I bet he doesn't have a fit about them at all, you know, because I guess they're not playing doctor, huh? Right, let's sort of see where we're going now. Try that and see what you can do with these sort of combinations of movement. And as you keep your rhythmicity going, try and sort of vary a bit, whether you do rotation, whether we enlarge the side bend, whether we get a little bit of a side bend with a rotation. Try and feel if there's just a little bit of extra attention needs to be spent on that. Then as we go here, could you just resist me? Oh, wonderful. Now let it go. Back a bit more with your shoulder. Just pull back a little bit more with your shoulder. Excellent, excellent, excellent. Okay, that's good. That's a new position. Right, let's go again. There we go. Like this. So we can use a combination, just switching between one technique and the other as we feel the end feel requires this. Okay, so let's just do that, just to give your brains a bit of a rest from trying to think about all these combinations of positions and so on.
They call those neutral lesions?
Don't just draw this down for a second until we see if it works. It's just a little brilliant idea I had that we would finish the afternoon off. It might be a flubber. All right? Do you remember when we spoke this morning about just this this localization? I'll kind of exaggerate the level here. Okay, that if we were missing this rotation in that direction, okay, we would try and obtain it, and there are two things that we can do. If we're into flexion, all right, we are going to side flex this way, and that would be side bent to the right in the presence of right rotation would be a congruent movement. If we wanted to lock this in flexion, we'd side flex the opposite to the rotation like that. And that when we spoke about this lower segment, if we placed it in lordosis, we had to put the pack under this side, which is to the same side as that rotation, so that we have a side flexion to the right, which rotates this to the left and stabilizes it against right rotation. So just have a look at this kind of setup that we have here now, and let's translate that into a lying position. And we'll finish on this so it can just go around your brains until tomorrow morning. Okay? So we're going to deal with right rotation. So here's the laying down. We've got the patient laying on their side looking at us, okay? So the right side is on top. And I'm taking it in our classical position, the right shoulder is going backwards here. So I'm not going to try and sort of do this on the diagram particularly at all. I'll just draw the diagram kind of like this. All right. Now then, if we want to go into a flexed locked position, all right, and this is the level that I'm trying to move like this, I would place in flexion, let's see if we can do it with black and colors. I would place the side bend here to give me a side bend to the left, in the same way as I side bend left there. So I place the pillow underneath the upper segment, and so in the presence of right rotation, I'm in left side bend in flexion. That's the non-congruent locking position. Next example is this, that if I want to take the upper lever into extension rotation, what I'm going to do now will be, I needn't even put the legs in on this because we're not even worrying about those for the moment. There, space, and what I'm going to do now is I'm going to lift the bed up like this. So the patient is now up in right side flexion in the presence of right rotation, which is the non-congruent position for extension. So blue represents extension. Now what you're going to find is the same thing as this, that in lordosis, if we want to place this lower segment in lordosis, the side flexion was to the same side as the rotation from above. So what we would have now, if we look only at the lower segment, is that we would have this side flexed like that in lordosis. And that would make this resistant to right rotation from above. And if we take the other example, this example, we can go back to here. If the lower segment is in flexion, what we're going to do here is to put the pillow under that part and side flex this over like that. So in flexion locking, whether it's from above or below, we're going to put the pillow underneath the patient and side flex them over it. Whereas if we're using extension, we're going to lift the table up Or if we were using a pillow here, of course, it'd have to be up here somewhere, but we're going to lift the table up to give us the locking in extension at either end. And so our ultimate, so that Bruce can go away feeling happy this afternoon, would be, what would we do if we wanted to have opposite from above and below? And so I will do this in red, so we have a suitable kind of different color, and we'll put it here like this. If I wanted to use the upper lever in extension and the lower lever in flexion, I'd lift the table up like that for my upper lever there. There's the joint I'm trying to do. I'd put my towel, my roll under there, which would side bend this way. That's side bent that way. And now I've got both congruent, non-congruent locking above and below. This one in flexion, that one in extension. And this is what we'll start off in the morning. But if you sort of think to yourself, it's not quite as difficult, and it's all based on this particular little diagram in sitting, so that we can do locking of one lever or another. Now, the advantage of this lever, as you can see, is that if we tried to use the upper lever and we want it as stiff as possible, it'd be nice for all of this to be in front of our body so that we could push into it. Whereas if, in this case, we've got the patient in the flexion lever, I'm kind of slipping over the top of them because they're already the shoulders back and I'm working over them. It's not in front of me. So this has got a great advantage if we want to use the upper lever, all else being equal, to use it in this side flexed to the right position in extension, because it's a stiffer lever. And this is what we'll discuss tomorrow. When would you ever choose to use any of these things? And so this will be the last bit we'll do on this locking tomorrow. I hope to get that done today, but you know, you've done enough today and I think it would sort of miss. But I wanted just to mention that because that's what we'll be doing in the morning. So if tonight you can just go through this and then kind of translate that diagram into a side-lying position and see how it looks, you'll have all of this organized tomorrow morning. But it's predicated upon this understanding. And of course, it's predicated on the rules I spoke to you this morning, where there are one or two differences of thought processes amongst the instructors, obviously, of the Institute here as to non-congruent and congruent locking. Okay, at the very worst, it means what I'm saying is a non-congruent, one of the other people have been saying is a congruent lock. That's the only difference. But you can see, when we go tomorrow, which appears to be the stiffer, if we side bend this way in extension, or if we side bend it towards the rotation. That will tell you which is the congruent position or non-congruent position. It should. Any questions? Have a nice evening. See you in the morning, 7:30. Last night? No. Okay. Friday night, right. Okay. Let's just see if we can do 4 little things. And all I'm spending a bit of time for here is doing them because, as I said yesterday morning, what we started with, there is a slight difference of opinion here in terms of congruent and non-congruent locking. And so you'll have both kind of views on this. And I'll try and make it a little easier by diagrammatic representation. Whether it makes it easier for you or not depends, I guess, on if your brain thinks in diagrams, all right? But let's just put 4 little diagrams down with the possibilities of the upper levers and the lower levers, all right? First of all, the upper lever. Let's take the situation. I did a little thing before I came down here to see how it would work, and it worked quite well for me, so let me use the same thing here. Can't find it. So here we go. Let's take the situation of a patient lying on the left side, which means fundamentally we're going to be doing a right rotation. And we can achieve a right rotation in two ways, of course, as we know. We can take the shoulder more posteriorly, in other words, rotate to the right from above. So I'll just put down shoulder being taken more posteriorly. Or we can achieve it by taking the pelvis forwards. Both of those would achieve right rotation. And it just depends on which lever we're using and why we're using that lever. But it still is going to produce a rotation at the joint that we are concentrating our forces on. So, here we've got the patient lying on the left. So the first example will be lying on the left, and we'll talk about the upper lever. So here we've got the patient lying on the left. There is the block, and I'm only going to draw the upper lever here. And I'm saying that as we go into this held in extension, we're going to raise the table up like that, so that we're going into right side flexion. And right side flexion in extension is stable for right rotation. Hello?
What confuses me is how do you know you're in extension there?
Because I've written it down. I mean, I can't represent an extension on the board. I'd have to kind of represent this going back and things. So all I'll do is I'll write it here. So this is, this is facing us, okay? We'll stand at the front here. All right? We've placed it in extension, so we've pulled it into extension so that when I've done the rotation, Ken, can you just come here for a second? Okay, so we want you laying on the left side. Okay, so Ken is on the left side. So what I would do here is, you know, the way to produce an extension here is to simply pull up and back like that, and I've already lifted the table up. So he's gone into extension. So that's what I'll put on the side of the board, what the position of the spine is in. Thank you. So it's in extension. That means as we lift the table, it's going into right side flexion, and that is stable for right rotation. So that when we produce right rotation throughout the whole of this lever, because this is stable and doesn't want to right rotate, the right rotation will be focused on the first joint that's in its neutral position. Now then, let's take the next example with the upper lever, which is to put the lever in flexion. And when we put the lever in flexion, what we're going to do is to produce. Here's the joint that's in its neutral position. We will place the pillow underneath the lever like this to produce a left side flexion. And in flexion, left side flexion is stable for right rotation. So that when we produce our shoulder going back and we try to produce a right rotation with the shoulder, it doesn't want to take place in the whole of this lever because it's stable for right rotation, so it focuses it once again on the joint that is in the neutral position, and we can fine-tune back to that point and then mobilize it. Now then, let's take the situation of using the lower levers. And remember this thing yesterday, I tried to get away from the business in the lower lever of calling it congruent and non-congruent because it brings about a few complications which I can address. But let's take the next case here. We've still got the patient in left side lying, and we're still trying to achieve right rotation, and we'll achieve it this time by the pelvis coming forwards. That's what we'll do. And so what we're going to do now is to think about what position the pelvis should be in. So that I'm just going to put the neutral joint on here. And if we go into lordosis or extension, that will be the essential position of the lever below the joint that we're leaving in its neutral position. And once again, if we're dealing with extension, we will place the spine in right side flexion, and we'll leave the bottom leg straight, and I'll represent it like that. So that if this spine has been taken into right side flexion in extension, it's stable once again for right rotation. So the spine here is in lordosis. We're going into right side flexion, which means that it's stable for right rotation. The last of the scenarios will be this. We've got the neutral joint there. We'll place the pillow like this, and we'll have the side flexion to the left. So we're in flexion now for the lumbar spine. This is below caudal to the joint in question. We'll leave the bottom leg in this particular case will be bent. So I'll represent it like that. That's the bottom leg, and we'll see this when we come to do it. So that we've got this now left side lying. Okay, so now we've got left side flexion in flexion, which once again is stable for right rotation. So those are the things that we're doing. Now I know that we're looking at congruent levers here because of this argument yesterday, but I just want to leave that alone for a little while, because we've had just a few controversies about this even within the Norwegian system, and I'll perhaps leave it as this at the moment, and then perhaps towards the end of the week we can talk about congruency and non-congruency below this. Now then, if we were talking about double locking, let us say, all right, where we perhaps had, here's the joint that's stiff, so I'll represent that by that and fill it in. That's the stiff joint. And here we have a joint that is hypermobile, like that. So we wouldn't really want to include this hypermobile joint in the lever. We'd want to support it, make it stable, but not involve it in the lever. So what would be probably quite a good scenario in this particular case would be this. We would place this in its stable position for right rotation. So we'll put it here. I will choose, for the purposes of this, to put it in side bend like this. So we've got that side flex that way. And because I want to use the upper lever, we know from consideration that if we're using a long lever, it's best to get it as firm as possible. So we think about the non-congruent locking anyway. But extension levers are always more firm than flexion levers, simply because of the apposition of the zygapophyseal joint. So it would be a good idea, thinking about having to go through a long lever, and all else being equal, to go through an extension lever with this top thing here. So what I could do is lift the bed up, come up here like this, and I would be actually producing the right rotation with the upper lever. This one being supported and quiet, but in a relatively stable position against right rotation. So here we've got a case where if we looked at this, it would be exactly the same. So we've got a side flexion coming up to the right, like this, and on the bottom here we've got the double curve looking from the posterior point of view. So that if I've changed this from flexion to extension, and the rotation is the same thing, I've got to change the side flexion from one to the other in different components, because this is held in flexion and this is held in extension. So the only thing that I can change is the side flexion component, and that's what I've done in this particular case. We've got this side flexed to the right, we've got that side flexed to the left.
I don't know if anybody else has, but I've lost what the difference is between this example that you're doing and what the example that you did previous to this when you were trying to get increased right rotation in extension from above, and then
There is no difference. No, what we're saying is now I'm putting these two, or taking two of these diagrams and putting it together on one example.
whether you had a hypermobility below that or not, you'd still set it up the same way.
Yes, but I would choose, if the hypermobility was above, I might choose to leave that in flexion so I didn't stress it very much, and then move this one in extension so that it's a bit firmer. So that's how I would sort of work this out. Whether this is in flexion or whether that's in extension would depend upon the efficiency of the lever. And if this was hypermobile above, I'd probably put this into flexion because I can't stress so efficiently through it, so it would save it. It would make it fairly firm, but on the other hand, I wouldn't have any tendency to try and push through that lever, as we'll see when we go to the beds. So that's a good point. Anything else? Good thing to start with this morning. Okay, now, what we're going to have a difficulty with is this one, on the beds as they are, because we don't have one that comes up, and it's not so efficient putting people on pillows under their shoulders to try and lift them up, as it is just simply lifting up the end of the bed. That's very easy to do. Okay, so we'll have to try and simulate this as best we can, perhaps working in threes or whatever, because I want you to try and get a sense of the firmness of the extension levers. We felt that in sitting. I mean, there's absolutely no question in my mind as to whether an extension or a flexion lever is in the non-congruent position, which is the most firm. It's certainly the extension levers. But we might have a bit of difficulty in the side-lying positions to feel this, simply because we cannot get a very efficient side flexion on pillows. So hopefully with these little diagrams, it's going to sort of illustrate a slight difference in your notes with the non-congruency and the congruency taken directly from Friot's laws, or the way that probably most of the rest of the world looks at locking. So there's obviously a bit of a controversy, and you can try it out for yourselves. You've got to sort of get a sense of feeling this and not just accepting what anybody tells you or what's down in books and so forth. You've just got to sort of try and get what feels to you to be the best theory to follow. And I'd like you to do that. I mean, that's what we're trying to do, is to make you challenge all of the stuff that we're talking about. Okay, so let's go back and look at just a little bit of detail on here. How are you?
Good to see you.
Yeah, thank you.
New assistants, new today, Rob Parker and David Deppler.
Oh, hi, Rob. Good, yeah.